I am Dr. A. Navaladi Shankar, Senior Consultant Orthopedic Surgeon, practice at Apollo Hospital, Greens Road, Chennai. Today we are talking about joint preservation program. That's been launched so that almost 6 million people have been affected by arthritis in India. So we wanted to preserve them, prevent them to undergo arthritis. So that's the reason we started this program where we catch up the joint which is undergoing early arthritis so that we can treat the early arthritis, maybe a sports injury person or a middle-aged female, so that from there we can do like this biologics, like this cartilage replacements, like this bone transplant, so that they don't go into the future metal hip or knee replacement. So basically getting them at the earliest. So we do that. We have gamut of options starting from PRP to bone marrow concentrate to lipoaspirate to the cartilage transplant, bone transplant, everything is being practiced at Apollo so that basically we have to diagnose the arthritis early so that they don't go to the replacement at a later stage. So we want to take away the metal and come into the natural bone, natural cartilage, natural ligament, natural meniscus.
About this program, who was the chief guest?
Yeah, we today we thought we'll invite the chief guest, Mr. Sandil Nathan, who was with MRF Base Foundation. So these are the people who see a lot of sports people who bring up a lot of sports. They see a lot of sports injuries, so that to bring them to the knowledge of the sports people, because everybody are talking about sports injury means only ligament tear, meniscal tear, reconstruction, meniscal repair. But beyond that, you see a cartilage injury. So that cartilage injury has to be addressed so that the sports person can go back to their sports. Otherwise doing only ligament reconstruction, leaving the cartilage, they're not getting back to effective sports. So where we have to treat the cartilage defect also and treat the cartilage injury also. So that's a basic idea to get the sports academy of Tamil Nadu or all over India to get into that also. It is good for the IT people, young people, because young 30-year-old female coming to us with the anterior knee pain. They think it's nothing, just முட்டி வலி அப்படின்னு சொல்லிடுறாங்க. அது கிடையாது. நம்ம என்ன ப்ராப்ளம் முட்டிலன்னு சொல்லிட்டு எர்லியர் டயக்னோசிஸ் பண்ண அந்த அந்த கார்டிலேஜ், அந்த குருத்தெலும்பு அப்படின்னு சொல்லுவாங்க. அதுதான் பேசிக் ஃபங்க்ஷன் ஆஃப் ஆல் த ஜாயின்ஸ். அதை நம்ம டயக்னோசிஸ் பண்ணால் தான் சீக்கிரமாகவே தேய்மானம் ஆகிறதுக்கு நம்ம முன்னாடியே ப்ரிவென்ட் பண்ணுறது. அதுதான் ஜாயின்ட் ப்ரிசர்வேஷன் ப்ரோக்ராம். தட்ஸ் இட்.
Fast bowlers for the country. That's what we do. And so basically, just want to take you into a little bit more cricket. Any fast bowler, when he runs from the run up and he delivers the ball on the crease, he sort of loses seven times of his weight goes onto his legs, basically onto every delivery. 7 times of his weight is huge. And he's not bowling only one ball, he's going to bowl many overs and things like that. So when I was thinking about joint and things like that, it starts from the ankle, moves on to the knee, then probably the glutes, hamstring, and the basically affected areas, the fastest, where it happens. So I was thinking about this program. So if any of the boy has got some kind of a niggle, we call it, so or any pain, so this program can be useful for them so that they can be diagnosed at the early, given a rehab program, and ready to play will be much faster than he injures himself, gets into a surgery, and then does a rehab and then get into it. So in that way, I thought the joint preservation program could be very useful for any sportsman. Not I'm just talking about cricket, because I'm with cricket, so I'm just talking on the basis of fast bowling, how we get into this. So that in that way, so this program going to be useful to any sports person. I think I was just talking about a lot of arthritis and things like that, and the last doctor touched about the sports. I was just thinking, what am I going to do about sports? So he touched, and thank you for that. And in general, sports.